Welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. Today, our special guest is County Executive-elect David Crowley, a former state assemblyman who will be sworn in, I believe, on May 4th to replace our current county executive, Chris Abley. So, David, thank you for joining us. And we'll start again with an update from Dr. Raymond on our healthcare status, and also a little bit of a look on the framework for dealing with COVID-19, both from a community and a company perspective.
Yeah, thanks, Tim, and good afternoon, everyone. Today, there were 78 new COVID-19 positive tests in Milwaukee and 207 in Wisconsin. And like yesterday, when we had 225 cases, I expressed some concern by the 207 number because it is significantly higher than the numbers we've seen over the last 2 weeks. So this bears some of our attention as we go forward. Average daily growth rates, calculated using all of the data since March 12th, continue to improve to 5.3% in Milwaukee and 6.1% in Wisconsin. And the 7-day average daily growth rates improved in Milwaukee to 2.9% and worsened slightly in Wisconsin to 3.9%. And the doubling times continue to improve both in Milwaukee and in Wisconsin at 13.15 days and 11.4 days. If I could go to the next slide, please. As we begin to coalesce our future planning for a smart restart in the context of the Badger Bounce Back Plan and President Trump's guidelines for Opening Up America Again plan, we thought it would be helpful to consider those through the Smart Restart framework shown here. And Tim shared this slide with you earlier this week. And on the slide, it shows 3 sectors of society working together toward the common purpose of dealing with the twin threats that the pandemic poses to our health and to the economy. There are 3 sectors of government and public health, the business community, and the healthcare and science sector working together. And the collaboration among these sectors is so essential. Working together, we're developing health and safety indicators to signal when we can begin to move into our smart restart. Now, the second part of the plan, shown as number 2 on the left, involves safely dialing up a revitalization of livelihood in phases. And the third involves containment and mitigation approaches. And I ask you to please take a moment to consider the life, economy, and community priorities, for which one key focus must be the development of workplace health and safety practices, and the MMAC is doing remarkable work in that area. So to start that conversation, we're putting forth a few principles for consideration, which are shown on the next slide. This slide summarizes another area of collaborative leadership spearheaded by MMAC to develop a framework for addressing workplace health and safety principles. And the content on this slide was prepared by Dr. Laura Cassidy at MCW, based on an extensive review of best practices to prepare and protect our workforce, our customers, and our facilities. The principles for each of these areas have been informed by the CDC, the World Health Organization, and OSHA. And these principles are comprehensive, and we believe that they can be adapted to and adopted by many different business types and sizes. And they also integrate the fantastic work and the models that are being discussed across our state by many organizations that also have embraced the collaborative spirit. Now, we believe the next step is for business leaders to provide feedback on these principles so that we can adjust and inform more precise guidelines for best practices. So I thank you for your thoughtful consideration, and I'll turn it back over to Tim.
Thank you, Dr. Raymond. And I really compliment the Medical College on putting that slide together. I think it's going to be very helpful. I know we're going to add that to our website as companies think about coming back online and dealing with their workplace, their customers, and their employees. So that's going to be a really helpful guide for us. So thank you for putting that together. Let's pivot a moment here to our county executive-elect, David Crowley. I hope you continue to have a smile on your face like you do on the slide below us. I'm sure that was taken before the election, but maybe a good place to start, other than congratulations in your new role, is what role does the county play in addressing the COVID crisis?
So first and foremost, I want to say thank you for having me. And I want to thank all of the residents and also businesses that have really weathered this storm, this COVID-19 crisis, and making sure that we're in this together. And the role that Milwaukee County needs to play is making sure that we are a partner with the healthcare systems as well as the business community. We want to focus on making sure that we have a healthy community, but that's not to say that this does not go hand in hand in opening up our economy and making sure that it works. If we want to make sure that we're on the best road to recovery, we have to make sure that we have a healthy community. So we have to work well with one another as businesses, as government, and again, as healthcare providers to make sure that we're making sound decisions. And we have to start focusing on what does it look like to open up. It's like a dial, it's more like a dial, not like a light switch. We need to make sure that we can turn things up or down, turn things on and off to make sure that we're not continuing to spread this virus. But we have to make sure that we're working well with one another to make sure that we're having a healthy community and opening the economy back up here in Milwaukee County.
And David, can you talk a little bit about how the county's been impacted by the COVID crisis?
Absolutely. So we know before the COVID-19 crisis, the issues that we were facing here in Milwaukee County when you think about the financial challenges. But one thing that we do know and we are preparing for is that we're going to see an influx of individuals utilizing many of the county services. Milwaukee County provides many of the social net programs that many folks need, and we take care of our most vulnerable here. And so we are expecting folks to come into these programs and utilize them much more in the future. So we have to be prepared for that. We are working with state officials, the state legislature, the governor's administration, our federal congregation as well, to bring back as many resources as possible to make sure that we're on the best path forward to make sure that Milwaukee County is in the best health and the best and healthiest place. And so right now, we do have a good team. I can definitely tell you that we are having a much slower transition, 60 to 90 days, to make sure that many of the essential folks who have been at the forefront of this crisis continue to lead. And so there is a major impact, but I am optimistic that Milwaukee County will be putting its best foot forward to making sure that we'll not only have a healthy community, but that translates into a healthy economy.
Do you have a sense of any of the federal relief packages and how they flow to the county and how that works?
Well, I know that we're going to be receiving some money from the state with the stabilization fund, but from the conversations that I have had since winning the election, we do know that they are currently debating another package. I have talked to both Democrats and Republicans in Congress to see what they can do for Milwaukee County, and people are fighting. And so we're going to do everything that we can to bring those resources back. They understand the issues facing not only just our businesses, but Milwaukee County in general and many of our residents. And so I am confident that those resources will come to Milwaukee County, but it's about how do we work well with one another. Again, bringing the business community, bringing our healthcare providers to the table to make sure that we are leveraging every resource that the federal government is going to provide.
So it sounds like you're already hard at work on this, but when you sit down on May 4th and take your seat as county executive, what's on the top of your to-do list?
Well, I want to continue to make sure that we are continuously talking about the COVID-19 crisis. I want to build upon the foundation that the current county executive has built around racism being a public health crisis. And we know that here in Milwaukee County, there has been issues as it relates to health disparities, and a lot of it falls along racial lines. And I think the COVID-19 crisis has shown a glaring spot in that. And so I think we need to continue to build on that to make sure, one, we are taking care of our most vulnerable and strengthening our weakest link, to say, but it is making sure that Milwaukee County works for everybody. So we're going to focus on racism as a public health crisis. We're going to make sure that we're bringing as many resources back to Milwaukee County so we can be on that road to economic recovery. but more importantly, when this new normal comes, we make sure that it's something that everybody has access to. So when the tide rises, all the boats rise. And even though we are in challenging times, I'm looking at the many opportunities that are presenting itself.
Yeah, and have you had a chance at all to start to work with mayor and so the city and county have a kind of unified response here?
So I've been a part of some of we have two operation centers. You have the Milwaukee County Operation Emergency Center, and you also have a Unified Operation Emergency Center. And I have been involved thus far with both of those bodies, having conversations about how we move forward together. But I think it's extremely important that with the Unified EOC that we have, Emergency Operations Center that we continue to allow our public health officials, our public safety officials, and public and health providers to be at the table guiding this and making sure that we bring businesses on board again. There are a lot of conversations happening, but it's extremely important that we are all on the same page to make sure that we are opening this economy to a healthy community.
Great, thank you. And I know you're going to stick with us, David. Let's bring Dr. Raymond back in, and Chris, we've got some questions from our viewers.
Yeah, a question both for Dr. Raymond and for County Executive Crowley. Dr. Raymond, can you explain what a robust contact tracing process might look like? And for County Executive Crowley, what are the county's current abilities in that area, and what is your plan going forward for contact tracing?
So thanks. I'll go ahead and start. It's an outstanding question. For robust contact tracing, we need to be able to identify people that are COVID-19 positive or they're suspected to have the illness, and then rapidly interview them to find out what they've been doing over the previous week or so that we can then have the same interview process and testing process with people they may have come into close contact with. Because COVID-19 is asymptomatic for a period of time, it's important that as early as possible, we're able to identify people that might have been exposed so that we can isolate them and test them.
And from the Milwaukee County perspective, so Milwaukee County doesn't technically have a health department. So we have 11 different health departments that we kind of have to coordinate with. And so we want to continue to support many of those public health officials who are making many of the decisions at the local level. But it's extremely important that Milwaukee County continue to support them. Many folks are in these positions but don't have the resources or the staff to do the necessary contact tracing. But we also have to make sure that we're working with folks like Dr. Raymond and the Medical College of Wisconsin to continue to do this work. And I have to say the Medical College of Wisconsin has been doing great work around racial equity, and I want to continue to build upon what they've been doing thus far.
Another question for Dr. Raymond. Of the confirmed positive cases, either statewide or in Milwaukee, do you have any sense of how many of those patients have recovered? And what does the term recovered actually mean when you're talking about COVID-19?
Great question. We actually don't know what recovered means. I think it's mostly either symptomatic recovery or disappearance of the virus. And I'm sure many people know that sometimes the virus not only persists, but can come back after a negative test. And we really don't know what that means. We also don't know whether people that have recovered have immunity. So those are really, really important questions. Just in terms of insight about where we're having these occurrences of COVID-19, I think it's important that we always remember that COVID-19 is a stealthy pathogen. It can be spread by people that are contagious and still feel fine. And that it wouldn't surprise me if some of the areas of our state that haven't had a case yet or have had just a few cases might have more. They might become a hot zone because we're so deeply connected at the state and national level.
Another question along those lines for you, Dr. Raymond. Are you familiar with New York's antibody testing results that came out recently, and what do you think that meant?
Yeah, I am. Really interesting results that were reported today. New York City has about a 20% antibody positive rate, but the upstate of New York has a 4% rate. So again, what I think this highlights is the absolute urgency for Wisconsin, in particular Milwaukee, to do some testing out in the community. And I would say not just antibody testing, but also virus testing, we need to really understand deeply what's going on in our communities before we can have well-informed public policies.
Another question about the slightly higher numbers stated in these past couple days. Is that attributed to a couple of hotspots mainly, or could it be increased testing as well?
Probably elements of both. And again, what we need to do here is to test Milwaukee and other parts of our state in a very proactive fashion, again, so that we can make good decisions based on our local information.
Another question about immunity. What research is happening around immunity, and when might we know more?
A lot. And hopefully we'll know more within the next month or so, especially when we have communities like New York, where you have a large number of people that are convalescing or recuperating, and we can hopefully study those. And again, I want to tip my hat to New York for being proactive about getting out there and really trying to dig deep to get the data that they need to help all of us make good decisions.
We had a question about customer-facing businesses and how they might hope to operate before we get a vaccine. Maybe, Tim, you could talk about some of the guidelines our members are contributing here. But Dr. Raymond, what are your thoughts on that?
I'm going to defer to Tim and County Executive Crowley.
So I guess where I would start with this answer, Chris, is that as Dr. Raymond has described for multiple weeks now, this next normal, we're going to be dealing with COVID at some level for the near future until there's a vaccine and it's widely available. So I think the key is for any business that's customer facing or any business period, they're going to have to instill the confidence in their employees and their customers that their workplace is safe. And for consumers coming into a business, they're going to want to ensure, they're going to want to be insured that that is a safe place for them to go, whether it's to a theater, a movie, a play, or to get something to eat. And so, again, we're not the only repository for this, but I think there's a lot of really good best practices that are being developed, that are being shared, and that are going to be implemented. And this is a case where businesses don't have competitive secrets, and they should share with one another what they're doing to make those customers feel safe, because ultimately it is consumer confidence that's going to pull us out of this recovery, and safe places for consumers to do their business is going to be key to that.
I would definitely agree with most of that. I think that this also points out the fact of how government, businesses, and our healthcare providers need to work well with one another. This is one example, could be worker safety. How do we make sure that we're protecting the workers? People who own businesses want to make sure that not only their workers are healthy, but their customers are healthy. We in government want to make sure that the economy continues to grow and folks can get back to a new normal. And the healthcare providers want to make sure that we can get rid of this virus and really flatten this curve and do what we need to do as human beings. And so I think that we have to work with one another. And I think that this is a perfect opportunity for government, businesses, and the healthcare industry to find ways to get back to that new normal that we once had.
Great. Thank you to all three of you. And thanks to everybody who asked a question today.
County Exec-elect David Crowley, thank you very much for joining us. Our best wishes for a fast start. Dr. Raymond, thank you again for the update and for the very informative charts in terms of how businesses can go about looking at making their workplaces safer for their employees and their customers. And we'll see you tomorrow afternoon at 3:30 for a summary of the week. New information from Dr. Raymond on the healthcare status, and Mayor Tom Barrett will join us. Thank you and have a safe afternoon.
Thanks, Tim. Thanks, David.
Thank you.